Receiving health care when you are a caregiver is an essential personal commitment. Supporting each other as caregivers in the face of illness also helps us. Thibault returns to work after a severe infection with COVID. He wanted to go back to work, but Elodie notices that he is irritable and withdrawn. She knows that he doesn't have a GP, and she would like to talk to him about it to help him, but she doesn't dare. Isaac has sciatica again. His doctor told him to rest until he gets better, but he doesn't want to cause his colleagues more trouble, especially in the middle of an epidemic. What will they do if he stops? They probably have health problems too, and yet they don't stop, so he keeps going. Bruno walked out in the middle of a meeting without saying anything. He had a stomachache. He was all white. He just found out that he has Crohn's disease. He thinks that others will see that he is not well. They'll ask him questions. He's worried because he'll have to tell them he's ill, but nobody came to talk to him after the meeting. It's a relief, but really, he's a bit angry with them for acting as if they had not noticed anything. Aisha has just learned that her colleague has to stop working for a month. This is going to be a lot of extra work because she probably won't be replaced for a long time, so she feels a sense of unfairness, of anger. Maybe her colleague could have just taken it on herself like she does when she's struggling. After all, we are less sick than the patients, and at the same time, she feels bad for thinking that way. It's not easy to talk to our colleagues about their problems or ours. We don't want to disturb them or show ourselves diminished. Besides, they're not here to take care of us, but for us to heal the patients together. Yet accepting our colleagues' failures or illnesses as well as our own means accepting that we are all human, vulnerable. We can take care of each other. We can talk about our health problems, give advice, and help to find solutions. We understand each other as caregivers, and we support each other. For our own health, we also need to be treated by caregivers other than our colleagues. Choosing a doctor or any other caregiver for yourself is much more than an exchange of knowledge. It's building a relationship of care. It means allowing oneself to be sick or to be worried about being sick. To have compassion and kindness towards oneself is important, as one would do for patients. It's not easy to accept to become a patient. Doubts are holding us back. Will the doctor or caregiver understand me? Am I seeking help for nothing? We can be reassured. We won't be judged even if we make a wrong diagnosis, if we have a lot of questions, or if we delayed seeking help. By building a relationship of trust, we will be well looked after. We can also establish how much responsibility we want to share. The majority of healthcare professionals say they are proud and happy to care for other caregivers. They are generally attentive patients who understand quickly and are respectful. If in doubt, we can ask if they are willing to treat us. It's clearer for everyone. Official solutions also exist when you get sick to continue to work as a caregiver. Insurance policies, the Occupational Health Service. It allows us to initiate the changes necessary to preserve our health and give us the possibility to undergo treatments. Taking care of your health when you are ill means starting to take care of yourself. Being a cared for caregiver will make us more serene and efficient in our job, and perhaps better understanding the patient's position will grow in our empathy and compassion.